503-14-1342, Texas Medical Board versus Dr. Stanislaw R. Burzynski. If I say anybody's name wrong, please let me know. I'm terrible at pronouncing names. My name is Roy Scuddy, Kathy Egan. We are the judges assigned to hear this matter. Before we get started, let me go through a few housekeeping matters. We've had notices posted kind of to let everybody know where things need to be and how many things are need to be proceed. This is a public hearing, and as such, the public is encouraged to be here. However, the purpose of this proceeding is to hear facts based on testimony and documentation, and therefore this is not a public meeting where we are asking for any comments from the public. The only thing we need to have on the record are statements by lawyers and witnesses. Matters of confidential nature that, because of HIPAA regulations, would need to remain confidential.
The frontier of science is where the medical professional community insists that the real discipline of science be applied to protect patients. Dr. Burzynski and his witnesses will describe the frontier of science as the gold rush, where anything goes, especially unloading entire arsenals of medications on naive and desperate cancer patients and families, almost all in uses of these medications unapproved by the FDA and unproved by the accepted process of phase 3 study and peer review in the general medical professional community. The frontiers of science are not a wilderness or a wasteland. The discipline of science is not the guile of a gunslinger. And I'm going to summarize what we're going to talk about. First of all, misleading patients to form expectations about the outcomes of treatments for cancer that is likely to deceive or defraud or injure the public, and subsequent to Board Rule 190.8I, using false, misleading, and deceptive advertising. Secondly, Dr. Burzynski's failure to meet the standard of care and evaluation of treatment of patients A through G. This is a violation of Section 164.051A6 of the Texas Medical Practice Act, a failure to practice medicine in an acceptable professional manner consistent with public health and welfare, as further defined by Board Rule 190.81A, failure to meet the standard of care, and 190.A1C, which is the failure to use professional diligence. It's also a violation of Section 164.05385, prescribing or administering a drug or treatment that is non-therapeutic in nature or non-therapeutic in the manner that it is administered. Thirdly, Dr. Burzynski's failure to adequately document medical rationale for the coding and billing of medical services of his patients, or the patients in this case. And actually, this is only applying to the patients for whom we have coding and billing, which is patients A through G. Fourthly, Dr. Burzynski's failure to adequately document who was really making the evaluation and treatment decisions for patients A through G. And then fifthly, Dr. Burzynski's failure under Chapter 200 to meet the ethical and professional responsibilities of the physician involved in clinical investigation. This is for patients A through F, but it's also for patients G through CC. And the board staff will be focused on four particular areas. First, evaluation of tumor response. Secondly, reporting of side effects, adverse events. Thirdly, manipulating the process of institutional review board review and approval. And then other unethical and unprofessional conduct related to clinical investigation activities involving the treatment of the patients. Sixthly, Dr. Burzynski's failure to obtain adequate informed consent. Seventh, Dr. Burzynski's failure to disclose ownership interest to patients, referring a patient to a facility, laboratory, or pharmacy without disclosing the existence of the licensee's ownership in the entity to the patient. Eighth, Dr. Burzynski's practice of medicine by unlicensed subordinates, the appearance of the practice of medicine by unlicensed subordinates, and inadequate supervision and improper delegation. Ninthly, and this is the ninth and last enumeration, Dr. Burzynski's misleading promotional statements to the public, including articles describing the results of Dr. Burzynski's clinical investigations. Today, Dr. Foss will explain why Dr. Burzynski's conduct, practice model, clinical investigation model, and public marketing statements are cheating on the discipline of science. Tomorrow, Elaine Clues, the coding and billing expert, will explain how Dr. Burzynski and the employees under his supervision, direction, and control cheated in coding and billing for patients A through G. Monday, Dr. Wetmore will explain the details of how Dr. Burzynski and the employees under his supervision, direction, and control cheated on the standard of care, and how Dr. Burzynski's conduct, practice model, and clinical investigation model and public marketing statements are cheating. Tuesday, patient F and his wife, and Wednesday, patient A's wife, will testify how they got cheated by Dr. Burzynski and the employees under his supervision, direction, and control. I thank you.
All right, before we start, I know some people standing. There are some chairs.
Honor and my commitment to represent Dr. Stanislaw Burzynski along with Greg Myers, Ms. Rubinsky, and Dennis Hester. The purpose of my opening is not to engage in hyperbole and name-calling and talk about historical figures that won't be anywhere inside this courtroom. It's about to talk about the facts of the case. Not name-calling, not silver bullets, not long-dead physicians, but about this man, Dr. Stanislaw Burzynski. He's an internationally recognized physician. He pioneered the use of biologically active peptides for the treatment of cancer. He graduated #1 in his class of 250 in Poland at the age of 24. He earned his PhD the next year as one of the youngest in Poland's history. Between 1970 and 1977, this doctor conducted research at the NCI at the Baylor College of Medicine, authoring 16 publications. This man is experienced in treating cancer with a combination of targeted agents and the drug phenylbutyrate. He has co-authored over 300 scientific publications. He has, as of June of this year, he's held 244 patents, it should be patents, in 35 countries covering 17 proprietary scientific inventions. There are multiple entities involved, some of which are confusing to me. Again, as Mr. Myers noted, we're kind of late-breaking newcomers into this. The first is the IRB, the second is the Burzynski Clinic, and the third is, of course, Dr. Stanislaw Burzynski. The Burzynski Clinic was established in 1977. It has grown to be an internationally recognized clinic providing cutting-edge cancer treatment. By definition, it is alternative treatment to the traditional cut, poison, and burn treatment that's so often used today. For over 35 years, their approach has been to provide personalized medicine for each patient, understanding each patient's genetic makeup, identifying the treatment strategies that may be more effective and cause fewer side effects than the traditional treatment. This personalized medicine may include the combination of targeted therapies with conventional therapies. And since 1977, they have treated more than 8,000 patients receiving treatment. There have been more than 2,300 cancer patients treated in FDA-reviewed, IRB-approved, and clinical trial programs. When patients A through G were treated in 2010 through 2012, the clinic had at least 2 to 3 board-certified medical oncologists. There were 2 other licensed physicians that worked under the board-certified medical oncologist, as well as Dr. Burzynski. The clinic has developed a safe and effective method of combining drugs for the optimal results. The clinic sometimes employs traditional chemotherapy agents, typically and oftentimes uses small moleculars or antibodies which inhibit cancer cell expansion. Additionally, almost all of the patients receive sodium phenylbutyrate. I always step on that word, PB. The FDA, it's FDA approved for non-cancer use, but the FDA recognizes its use for several types of cancer. It's not commonly used outside of clinical trials for cancer treatments. The patients listed in the complaint, patients A, patients B, patient C, their tumors shrank. Patient E received treatment only for 8 days. Patient F was on the, you will hear from him and his wife, I believe, on Tuesday. He was on the clinic's combination therapy. He was given 3 to 6 months to live before coming to the Burzynski Clinic. He literally had a death sentence as his prognosis. He has now survived 5 months. Patient D only had a consultation and never even started treatment. In response to the general allegations, Dr. Burzynski and the doctors of the clinic did not violate the standard of care. All the patients listed in the complaint came to the clinic with a diagnosis of cancer. The notion in some of these experts that suggest that the TMV's witnesses at least will suggest that there wasn't an adequate diagnosis of cancer before they came, or after. 95 to 98% of the people that come to the Burzynski clinic have a fatal cancer diagnosis. 95 to 98%. The evaluation and treatment was performed by one or more oncologists at the Burzynski clinic. The allegation is there was inadequate delegation and direction. All the clinical personnel we expect the evidence to show were adequately trained and supervised. The research assistants, again, never engaged in the practice of medicine. Every patient, including patients A through G, were told the research associates were not licensed physicians and their job was to act as an intermediary. The aiding and abetting the unlicensed practice allegation, the response is fairly simple. Practicing medicine is a diagnosis, treatment, or offer to treat a mental or physical disease, or the attempt to effect cures on those conditions.
Mr. Cocker, excuse me, I just want to clarify something.
Sure.
When you say intermediary, you mean they're just to pass information back and forth?
Yes, they pass information, they act as a liaison between the oncologist and the patient. Texas law does not prohibit a graduate of a medical school to be referred to as doctor or designated as an MD. They are in fact doctors and MDs. No research assistant ever represented that they were licensed to practice medicine in Texas. The witnesses for the board, I want to talk about them quickly. Dr. Fost will testify today. Mr. Myers will be cross-examining him. His testimony is almost exclusively FDA focused, and we will tell you from the beginning and admit from the beginning there were FDA regulations that were not followed. We further expect the evidence to show it's virtually impossible to follow all the rules and regulations because the rules are unbelievably burdensome. They make the Internal Revenue Code and the Bankruptcy Code look like a good idea. His Post's role with the FDA was serving on an IRB at the University of Wisconsin. He's never worked as a clinical investigator in a cancer investigation. Dr. Wetmore, who will be testifying, I believe, on Monday, she's a pediatric oncologist. She treats children. She's always been involved with academic institutions. She's never treated in private practice. She does not treat mesothelioma, liver cancer, pancreatic cancer, or many of the types of cancers treated at the Burzynski Clinic. Ms. Cluse should be testifying tomorrow. She's a CPT or billing expert. She cannot and does not opine on the efficacy or the standard of care. She takes the position that, and it's recognized in the literature, and we accept it, but her fundamental position is if it's not in the charts, it didn't happen. Her testimony is inaccurate on several key areas. There's a number of mistakes. There's a number of inaccurate assumptions. There's a number of erroneous conclusions that we'll show on cross-examination. On Dr. Levin, who is one of our experts, he's a board certified in internal medicine and medical oncology. He'll testify that the Burzynski Clinic treatment protocol was medically necessary, was consistent with the growing practice of personalized or precision medicine. His treatment style, this protocol, is finding acceptance in the oncology community, and the personalized treatment plans are supported not only by peer-reviewed studies, but by publications. He will testify, notoriously difficult diseases to treat, and the use of personalized medicine to treat such diseases is reasonable. Dr. Levin will continue to say that these medical records were clear and easy to follow, that they've demonstrated that patients turned down the usual standard of care, and that the documents show that they sought a personalized treatment or approach offered by the Burzynski Clinic. The treatment at the Burzynski Clinic, Dr. Levinson will testify, worked. It shrunk tumors. Many of the patients lived far beyond the prognosis given to them by their original doctor. Dr. Janecki will testify that the treatment plans and the success of antineoplaston treatment for patients are supported by peer-reviewed and published studies conducted at the Burzynski Clinic. He'll testify about the remarkable progress of the BRI and approvals for the FDA clinical studies, and that Dr. Wetmore made numerous mistakes in her pre-filed testimony concerning clinical studies of the BRI of patients H through CC. We're going to bring you a few patients. The first would be Mark Lydell. He's a lawyer. He had a level 4 glioblastoma brain tumor. That's a death sentence. You get glioblastoma, 95% of the people are dead within 6 months. The chemo and radiation doctors told him that he had about 6 months to live. The only treatment he sought and obtained with Dr. B was that available at the clinic. He experienced almost no side effects. He was practicing law within a few months after he started his treatment. Jason Merkel, a brainstem glioma. Everyone told him he would live 2 to 12 months. He believed that Dr. Burzynski's treatment was the least invasive, and Dr. Burzynski was friendly and optimistic. The side effects were being tired, and no other treatment. He was 20 years old when he started. He's doing great, no issues. He's married with 2 kids and has a great job. He'll testify he'd go back to Dr. Burzynski in a heartbeat if he was diagnosed. Mary Susan McGee, stage 4 esophageal cancer. The survival rate of esophageal cancer is 0. She went to other clinics who told her there was nothing to do. There was an oncologist in Bozeman, Montana, wouldn't help her. She sought treatment through Dr. Burzynski. They coordinated with the treatment and billings and were working with Dr. Burzynski. She paid for her expenses out of pocket. Dr. Burzynski's treatment cleared out the cancer. Her oncologist told her that she had a great response to the medicine. She's been cancer-free since Dr. Burzynski treated her. Dr. Rachmaninoff, Dr. Burzynski's assistant, called her every week. They monitored her treatment in Montana from Houston, and in her opinion, he's a superstar that literally saved her life. Mary Siegel, stage 4 non-Hodgkin's lymphoma. She saw other doctors before Dr. Burzynski at UCLA, at Stanford, and Harvard. Those other physicians prescribed bone marrow transplant. She didn't want conventional treatment because it involves a severe amount of radiation and chemotherapy. She suffered no real side effects from the treatment. She never thought she'd live to see her children graduate from high school. In fact, she's seen her grandkids, her kids graduate from high school and has 3 grandkids. Other patients, or a number of them, I won't bore you with them, but here's the bottom line. Dr. Burzynski has given his life, his soul, his work ethic, his every being to treating his patients. We do not believe that the board will be able to sustain their allegations. In fact, we think they are globally and horribly misplaced. We look forward to presenting the evidence to you, and with that, I'll cede the microphone to Mr.